Hey, good afternoon, and thanks for attending. My name is Stephen Flanagan with Therap Services. I also have online with me Robin Forbes, who will be assisting with moderating any questions that you guys may have. With these webinars, we tend to have a muted audience. We can unmute you if you have a particularly long question. Just go ahead and show your hand or do a quick question in the chat. If at any time you are having trouble hearing me, also let me know in the chat or via question, and we can see if we can do some corrections on the audio front. Currently, just a quick response from anyone online. Can you guys see my screen?
I can see it, Stephen.
All right, perfect. Thanks, Robin. That is Robin who's going to save the day. If you guys have any questions, because I will probably be paying more attention to the screen. What we wanted to do today with you guys is kind of just give you a walkthrough of, from a early intervention services perspective, what Therap can do as far as the case notes tool and generalized case management. Now, when you're on the Therap site, if I just go to the Therap site in general, you don't see a lot of talk or discussion about things like early intervention or early childhood services. You see a lot of stuff about intellectual disability and developmental disabilities. Our service providers, however, are offering a lot of different various services, and the system is used in a lot of various service capacities as well. So for today, we really want to focus on early intervention, looking at things like session notes and progress notes, writing assessments, and how you can use the case note tool to capture that information. Because if you go to the website and you were to look up, let's say you were to go and look at case notes to find more information about something like this, our information on our website currently is a little bit limited as to how you might go about doing something like this, or the insight as to how these various tools might be utilized. I think my page is loading. So we have a very brief blurb about what the case note tool is, but it doesn't tell you how you might be able to apply this in an early intervention session, how this might be able to replicate a session note or a regular progress note, or how it might reinforce what's going on in an IFSP. So that sort of information we're adding to the site through these various webinars, through some discussions we're having, and putting them in different places on the site so that people have some access to go back and see how this is applied. All right, so what I'd like to do, I'm just going to go ahead and log into one of our demo accounts. The information in there is pretty base, so we'll have to use our imagination a little bit when it comes to the billing aspect of case notes. But I think you're going to get a good idea about how this is going to be able to replicate a specific case note or a therapist note or a session note for your providers who are in the early intervention field. All right, so I'm going to go ahead and log in here. This wants to use a stored Google password, which is wrong for this. All right, so go ahead and log into this account. Increase the size a little bit here. So the first thing I want to do is I'll show you guys what some of these case notes will look like, and then I want to show you how you might go about setting this up within Therap. So the first thing I might do, if I'm a service coordinator for early intervention, or if I'm a therapist or a speech pathologist and I'm using Therap to write my clinical notes or my session notes, I might go to the individual homepage and see the list of all the individuals who are enrolled in early intervention that we're providing services to, or all of my clinical services, whether they're early intervention or other services otherwise. And I'd be able to go to that individual and be able to see from their dashboard, from their individual homepage, all of the various things going on about them that I have access to. So this is all caseload based. You know, you're only going to see health tracking information if that's relevant to you. If I am a direct support professional working with the person, 10 hours a day in our children's services program, I might not see things like case notes. I might not see things like the document storage. I might just see the stuff that pertains to me collecting regular documentation on the ADLs that we worked on and the functional outcomes that we worked towards, the regular naturalized routines that we engaged in for that time at that facility. So from a case note perspective, you get a quick view of either the last month's worth of case notes, the last few months, or you can do a search for case notes that you want to put into the system. You could also do a bulk PDF. In a lot of states that utilize Therap, Therap is used, but it's not the statewide provider. In a few of those states, Therap is the statewide provider for early intervention programs. So you wouldn't need to do a bulk PDF of these case notes. The state is just going to look at what you're using for case notes in Therap. However, in states that don't utilize that, you might actually be printing off bulk PDFs of your case notes. So you might have 3 months of case notes, a year's worth of case notes that you're printing off, sending to the state as far as your audit is concerned or as part of your billing, just as a regular information that might be going to those departments. So if I want to look at, for instance, my last month of case notes collected for this individual, all of those case notes are going to appear. And I can go into a specific case note, whether this is a progress note or a session note, and I can see some basic information about this case note. Now, Therap case notes are on a template basis. So you build a template from the beginning that all of your clinicians or professionals are going to utilize. Once that template is built, it cannot be changed. Once it's built and approved, it cannot be changed. So there is a little bit of legwork at the beginning in building these at the beginning. But once they're set, they won't really change unless the state goes through and changes some of their guidelines or their information fields that they need on a particular session note or a case note, in which case you would go in and discontinue the old version or copy it and then create a new case note template. But this is all built on a template model so that you build the template and then you can apply that template to multiple individuals' notes. So if I take a look at this progress note for Javier, you've got some basic information that is built into the system. These are optional fields. You choose whether or not you want to see things like time and service date, location, activity type, whether or not this is a billable unit, whether or not you have to note during the session if it was face-to-face or not, the persons who might have been contacted, maybe their parents or family members. All of this information is built into the case note template when you build that. So you'll see that when we go into that process. You also have a questionnaire that is associated with each of the templates, which are basically building out a set of questions and answers. I like to think of the case note as kind of doing some sort of form building, and this is where you're filling out the forms. Some of these sections are going to have a question, have a paragraph-based answer. Others might be date-based answers. So we have the service order, the procedure core number, the number of units. So some of these might be numeric, some of these might be text-based, some of these might be multiple lines of text, a paragraph that you're adding a response. Others might be drop-down lists or multiple items checked off, or you might have radio buttons. It's very flexible in how you're building your forms. So when you're looking at your state-specific forms for early intervention, whether it be a session note, a progress note, a clinical assessment, an eligibility determination, maybe a transition out of services questionnaire that you're filling out, look at those questions that you're answering and break them out into their singular components. And then what is the question that is being asked and what is the singular component answer, whether it be a drop-down or a multiple option and so forth. And that's how you're going to build those forms into your questionnaire to have your service coordinators or your early intervention specialists answer these sorts of questions. So they'll go through and answer those basic questions, and they also have a field to attach their basic notes. I'm not sure if there is a limit. I don't think I've ever seen a limit with these case notes. So you have very long session notes that you could include, or progress notes going over the course of that 3-month period or that year or that time period for that periodic check-in, and then any external attachments, assessments, anything that you want to attach to the session note or the case note itself. All right, so this is just a sample note that you're going to get as an end product, maybe of a session note. We can go through and show you how this is then built. So with these session notes, you can communicate to other other team members about this particular session note if they have access to the session as well. Otherwise, you could print it as a PDF and attach that file to communicate with a family member who may not have access to the session notes so that they can see this and they can sign off or verify that those services were delivered. Various forms and ways to do that. We'll talk about those when we're looking at building the case note. Questions so far on this? If I pop into edit, I think some of these fields that were dropped down, you can see some of these fields as they're going to look when you're filling this out as a early interventionist. So if you require a service date and time of service for a particular session, you can go in and fill in that time. Your time is in the hour-minute format with an AM and PM, or you can use the time signature to go in and select 10:30, 10:45. Click on that to get 5-minute increments if that's easier. I'll just click off of this to set that. It takes a little bit of getting used to using these little time indicators, but I find once you've played around with them for a little bit, it's a very quick learning curve. Service units and rates. Therap is integrated with electronic billing or third-party billing. You can do manual claims. You can do electronic claims in most states. So you can link this to your service authorizations for billable units. So if you are billing per session and you want your case notes to be the billable increment, you can create a service authorization and you can create a description code and a billing rate and have all of that linked to your case notes. And you can have additional supporting documentation behind those case notes so that an auditor who comes in and looks and wants to see everything that would have been done and is supposed to be there, they can go in and see the linked ISP programs where maybe you have your support professionals working on ADL skills, and you have your case note where you have your clinical specialist working on something like a speech pathologist might be working on an hour session and they're billing separately, and that is linked to the service authorization and it's linked to the individual family support plan. So there is a lot of functionality between this and other parts of the system. So if this is linked to billing, then I can select the billing unit and the pay rate. This is a very small pay rate, but we are, this again is just a demo account, so it's in here for showcase purposes. Your activity type. You are going to build a drop-down list of activity types for your case notes. And you will link those per the case template. So you can have different activities for nursing services if you wanted to build a nursing type template, or if you had a nutritionalist or a speech pathologist, you could have different activities that the speech pathologist could perform as part of their session and list those different activities for their particular case note. So you can get very detailed, very into the weeds as far as what sorts of activities and what sorts of locations you have for your specialists to choose from their options. So if you have different billing for different locations or activity types, you can create and modify those. Now, with each of these case notes, you have some default questions. You don't have to show these. If you have a particular case note for a service that you're not receiving, it's not billable. It's not something that you're receiving Medicaid or third-party funding for. Maybe it's just a block grant or grant funding that you receive services for this, and you are showing the information, but you're not classifying it as billable or non-billable information. You're just collecting that data. You can make any of these fields go away. So these are all optional fields that would show up if you want to kind of link and showcase some various bits about case notes to make them billable and to have those specific fields that states are going to look at for billable services. All right, Stephanie, it sounds like the sound is going in and out for you. Is anyone else having a problem with the sound?
All right, it looks like I'm back and dialed in. Hopefully the sound is a little better. Tend to have some sound problems on occasion when dialing into the computer. So fingers crossed. If not, just let me know if you have some problems and I can go back and repeat myself. Sorry about that.
Good. Thank you, Stephen.
All right, So you have those specific fields that you can include on the case note. You also have, when building out a questionnaire, we'll go ahead and open up the questionnaire to kind of see how this looks like when it's being filled out by a service provider. You have all of the questions that you will have set up, and your questions are all numbered. Your answers are all numbered. And this is for mapping in the future with the system. So these numbers default kind of show up. It's this way you can kind of see where you are in that process as well. If I were to look at something like responsive play interactions, I can see that there is a drop down of options that we will have built for, or that you will have built for this particular questionnaire. So you can use that particular option. And as you save and go to next, it just drops you down into the next one chronologically as you're completing your questionnaire. Now, as you have some of these large assessments and large questionnaires, if you're filling out this piece by piece, you can go and look for something like, if I'm looking for parent coaching, I can type in coach and filter that out, and it will bring me right to question 11, coaching. And click on that, and then I can let the system know whether I provided or do not provide parent coaching. So it's fairly quick to go through and fill these out. It's just your therapists and clinicians and your early intervention professionals are just filling these out one field at a time, like they would your paper forms. All right, and at the bottom, like I said, there is a period, a section for you to write your clinical case note in full. So you have your questionnaire where you can have small questions answered and some guidance as to how those questions are to be answered. But I think the character limits are about, you might have 500 characters as a limit for your guidance and 300 characters as a limit for your question that can be asked. And then your answer response might only be like 2,000 characters. So it's not anything that's very large. So for the bulk of your case note, you can go into the note itself and write that summary of the service or service period. And then again, when you're finished, okay, I don't like the word referral there without the 2 R's. Thank you, spell check. When you're finished, you can print off this as a PDF so that you can submit it to billing or share it with the family member so that they can read, review, sign off that they're happy with it if they don't have access to Therap themselves. So that's what your case notes are going to look like, at least for this particular session note. We have other progress notes that you can fill out as well. What I'm going to do, though, is walk you through that process of how you would go about building this for your agency, because this is another one of those places where if you were to go into Therap, if I go into Therap for case notes and I go into the user guide to fill out a case note or case note billing, it's not going to give me a lot of the rationale for why I would be doing certain things, like why I create locations or activity types, especially as a early intervention provider. There may not be all of that insight in these user guides. They're very much process oriented, functional. Click on this. This will create this form. You can plug in 2nd Street as your location. It won't necessarily tell you that these can then be utilized for your billing locations or where you might put in your HCPCS codes for billable services. So those sorts of things, I think, we'll get a little bit more insight as we go through and build one of these case notes. So I'm going to go ahead. I have to start from the admin page because there's a few things you have to build in the background. You have to build your templates, you have to build your questionnaires, and you have to add your activity types and locations if you want to utilize those in your case notes. There's also a particular set of provider preferences that you're going to be able to configure. And I'll turn the provider preferences on after we build one of these case notes so that you see a couple of things that are affected. Finally, the only other thing in the admin section that you might be doing is there's some billing components. So if you're not utilizing billing for your agency, you could utilize some of these billing components to link your billable case notes to your service authorizations to create a billable claim. So that billing information is all down there, and that might be done separately. All right, so we are going to start with your case note templates, and we're going to start with managing what your applicable locations are and your activity types. When I go to manage locations, I can write in a location name. So if I'm looking at particular service that individuals might come in for assessments or eligibility determinations might be done. Maybe some of those sessions take place at my home center. I can go ahead and add that as location. I might add something like home as location. As you add a list of locations as options, it will create a ongoing list of potential locations. Now, this is your master list of all locations that any case note can utilize. When you create a template, you will choose some of these locations to add to your list. I'm going to go ahead and add Metro Center services. I'm going to go to manage locations. Metro Center services are now added. Okay, so not much to that. Likewise with my activity types, I'm creating a master list, master inventory of all activity types that all case notes might utilize when my service coordinator or my early interventionist is going through that session or writing their progress note. So I have an early intervention progress note that might be done. Maybe I can add an eligibility determination. As a type of activity that my early service coordination specialist might be working, that service coordinator might be working on. And again, just like with location, that's added to the list. I'm not gonna show you guys all of the same redundant stuff in there. All right, so you've added your locations, you've added your activities. You can then go in and create a template. Now, this is a little bit premature because when you're creating a template, you're also going to go in and add a questionnaire, and you might have lots of questions as well. I can open this up for right now and create a draft template, and we can go in and see and add that questionnaire after. So we'll go ahead and do that method. So the first thing that happens is you're asked which of those field properties, when you open your case note, which of those first questions are going to show up and which ones are going to be required to be filled. Now, by default, all of these fields show up. None of them are required. But if I'm doing an eligibility determination, I don't need to know time. I need to know the date of the eligibility. I need to know the service unit and rate. So we have a particular reimbursement rate that we get for each eligibility determination that we do. I could include that, and that could be linked to billing. The activity type eligibility determination would be something done. A location, maybe we're showcasing that we're doing the determination at the office. Otherwise, it's probably not a required field. Likewise with face-to-face or person contacted. If you need those to show up for your billing information, you can have them show up. If you don't need some of these to show up, like if you're doing an over-the-phone referral, then you don't need to know face-to-face as a question, or you don't need to have the questionnaire. Maybe you're just, noting the person who was contacted and the activity type that you did. Hopefully that makes sense. I'm going to have all of these show up, but none of them are going to be required fields to fill out. Field values, you will need a name for this template. So if we call this a early intervention session note, and we'll just call this sample 2, so we can reference it. You do have the option of a time format. So for a session note, there might be a time in and a time out. We can use a time range, or it might be a duration. Maybe we don't want our specialist to note that this took place from 11:35 to 2:15. Maybe we just want to note that it was 2.5 hours. You make that call. I'm going to go ahead and use durations, as we already saw the time format on the previous sample. Locations. You've built your location directory. Unfortunately, the system doesn't have that directory accessible right here. So as you start to type out something like home, it will give you potential maps as well as those codes for billing. So if you wanted to note this happened at home, or if this happened at ABC Center, or if this happened over at, I think we added Metro Center Services, I can add those fields as a potential option for where my session note might take place. Maybe this is also an option to take place at a rural clinic. Okay, so I have my drop-down list of options. Now, when I create this template, I don't see the list of potential locations. When I'm a service provider and filling out the case note, I see these 5 drop-downs. So none of your staff will have to worry about knowing what all the potential locations are. It's just for you as the case note builder. Congratulations. All right, activity type, likewise, same thing. If this is a eligibility determination, or if this is a session, I don't have the word session in there. Maybe this is a progress note. I have those options. And then you see that section for the questionnaire. Okay, so this is where you can pull in a questionnaire that you will have built. I'm going to go ahead and link early intervention progress note 1 to this for right now, just so we have something to link to it, but I can go back and I can make edits to that case note template. I go back to view that template. That was inaccurate. I can make edits to the question. I can copy the questionnaires and add questionnaires. You want to have your questionnaires filled in beforehand because you don't have that edit option. So sorry about that, and to eat my words on that that I told you. So I'm going to go in and I'm going to build a questionnaire with those questions of what I want my early interventionist to fill out. So we'll call this provider progress notes or provider session notes, early intervention, and we'll call it sample 2. And then I can go and start to add questions to this sample. Now the questions, they'll ask what the title might be for that particular question that the staff will be asked to fill out. So if I wanted to note things like, using Therap, you're going to be filling out a session about the child or about the individual. So you'll have the child's name, you'll have the interventionalist's name in the system, you'll have the date of when the information is being added to the system, you have the date of service, which you put in, you'll have the time if you wanted to include the time. So you're really going to be looking at the forms that you have, removing the information that you don't need because Therap already provides that information, and then adding the remaining questions that haven't been addressed yet. So something like, I'm going to note what the session date is, but I may not know something like the question, were the parents available for this session? So I might ask, for parents or caregivers, say present at the time of session. Okay, so you have a question. Your questions are automatically numbered, and depending on what the number is, the system will display them in chronological, in numeric order. So if you forget something, you'll have to go back and change your question numbers to go back and fill in and add that answer to your questionnaire. As you're filling this out, that's one of the minor headaches of using the system is it doesn't have a drag and drop feature at this time. You'd have to go in and adjust those question numbers. So you can also have hint information if you want to add more flavor text or information guidance for your therapists or clinicians to fill out as they're plugging this in. For instance, if parents were not present, how did you communicate with them about the session? All right, and then you have your answer type. And this is where you're telling the system you want the answer to be an attachment. I did an eligibility determination, and I'm not going to have like a yes or no. I'm going to have an attachment, which is the state mandated form that was filled out. Or I want to put in an address, or I want a checkbox. For a checkbox, you can select multiple options. So you can put that how was the person's move or behavior for this session. You can select multiple options. Whereas with a drop down, you're selecting one option. With a radio button, you're selecting one option. Yes, no, not available. Time, date, text or text multiple lines. And text answer is you're writing a sentence or you're writing a response. A multiple line text, you might be filling out, you want to hit the enter button and you want to have new lines of data and text on each of those lines in your response. All right, so for this one, I just want a quick text answer. Yes, they were present. No, they were not. If not, I want them, I want to write in an answer of how we communicated with them. Okay, so I have that first question, and I can go ahead and go back to the questionnaire itself. You see the first question, I have a text answer. I can go and show details and make edits to this and make changes if I need. You also see you've got your guidance for your therapist or your interventionist to go in and add more details. And I will go ahead and add my next question. And Therap defaults this to question number 2. So then I can go and I can say, describe the progress the child has made toward the individual family support plan outcomes since the last session. And I can add additional information like include any feedback, parents, caregivers. And this, again, can be just straight text. I can just write forever, or I can go ahead and do multiple lines so I can add multiple paragraphs and kind of have it very much structured. You also have a field to note whether or not the answer is required. Now, when you're writing these session notes, you don't have to fill them out all at once. So you can answer certain questions as you're doing something like maybe a progress review for a case note, and then you can go back and answer other questions later. So if you don't make them required, it's not going to force the person to go and answer that question when they just want to go in and answer 1 or 2 things about what they did. Okay, so that's going to add that second field here. Again, 2 text line items. Maybe I want to add something about things like daily routines or ADLs that were worked on. So maybe I have a question like natural routine activities worked on during the session. And then I can add hints as well. But what I really want in this case is I want a drop-down list of which routines were worked on, or better yet, I want a checkbox. This way I can select if multiple routines were worked on during this session. So I'm going to go ahead and do a checkbox. And when I do that, it gives me the option to add answers as options. So I can go in and add my option for activities of daily living. You just put ADL in parentheses there. So that's one option that someone could have selected they worked on during that session. Add another option for, play or social activities. Maybe there's another option for community activities. Spell. And maybe, errands that you worked on with mom or dad and showing how to work towards those particular goals. So as you're adding all of those options, you can just continue to add answer options. You can go back and make edits. Again, the numeric structure is added by Therap, both in the questions and building the questionnaires and in the answers and building this. I can't go and build an answer option and list this as number 2 because we already have a 2. So in order for me to have a new number 2, I have to go back and change number 2 and make it 3. I might have to change number 3 and make it 4. So the first time you build these questionnaires, the first time you build your case templates, it can be a little bit burdensome. Break down the components of the form you are working on. And then as you go in and you're filling in those form components, you probably won't have to go in and make edits based on those numeric orderings too many times. You'll realize the first time you made an error and you have to go back and change 10 or 20 of these, you'll be looking out for those to not do that mistake again. But that is something we're aware of, and with constant updates to the system, I'm sure it will be addressed in a future update. So I'm going to go ahead and go back. I've got a very basic questionnaire with 3 of these options on here. you know, I can go in and add additional fields. Maybe I want to have this questionnaire that's being filled out have a space for a parent or guardian to go back and sign. There's not a naturalized place for a signature on a case note, so I might add a question. It says parent or caregiver signature, and you might have some information that you want as a hint that says, I attest that all services listed in this session note were provided and accurately described. Okay, whatever guidance you want to use, you can utilize that. Again, you're only given 500 characters to write, so it's maybe 6, 7 lines, 3 or 4 sentences. Likewise, for the question itself, it's only 250 characters. So these are not lengthy paragraphs that you're going to be including in these case notes, at least not in the questionnaire portion of the case note. And then for that answer type, I would just leave a blank text box so that my parent has a place to sign. And this is not a required answer, so I can submit this case note, print it out as a PDF, and I have a question that has a field for a parent or caregiver signature, and they can sign it if that's what the state wants to see. So I'm going to leave that blank. And now we have a 4-part questionnaire. Natural routines, progress made, were the parents present, and a parent signature. I'm going to go ahead and approve this questionnaire. Once these questionnaires are approved, they can no longer be edited. They can be copied, so you can make variations of a particular questionnaire, but you can't go back and make edits. The questionnaire has been successfully approved. I can go back to my dashboard, and I can go into my case note templates, create a template, and we'll go ahead and create that template, early intervention session note. That note we just approved at the beginning, this one we'll use instead, sample number 3. Okay, and for sample 3, we want to use duration. We want locations to include places like home, the office, ABC Center, and Metro Services. Okay, so those are our drop-down options that we want our specialists to choose from. And our activity types, we want an early intervention progress note, and we want a eligibility determinations, 2 options that they could use when filling out this case note template. Actually, for this one, there's no eligibility determination that's going on, so if we don't even want that option, just leave it blank. And then I want to sync that questionnaire that we did. So we'll use that provider session note sample 2 questionnaire. So that's the building in the background that you will do so that your interventionists have tools available to them to write case notes. Now, before they see case notes, but before I can go to my individual page or individual home page and do a new case note for Javier, I am not going to see that early intervention sample 2 case note. This is actually a different one. I'm not going to see it listed yet because I haven't approved it for my agency. All of those case notes are basically existing in the system, but they're hidden until you need to utilize them. Okay? And the reason why is because some of these case notes, you might have eligibilities, you might have assessments that you do periodically. You may not want all of your session specialists and intervention specialists to have a laundry list of items in that case note list to choose from. Maybe you only want certain things at certain times when you need them. So you can go to your admin page and you can go to your provider preferences and you can enable which of those case notes are going to be showing up in those listings. So if you just click on one item in this list, anything else will disappear and be unchecked. Okay, and this is basic web browser information. Clicking on one thing in a text box unselects anything else. But if you hold the control key when clicking, you can select multiple items. Again, just a regular standard click unclicks all the other items. So I'm going to include my progress note sample 2 that we created and the early intervention session note sample 3 as my 2 options in my case notes. And I can have a default template as well, information and referral. I'll go ahead and leave that because this account is also being utilized by some other people doing some information and referral sessions. Okay, so you have to fill out this case note template preferences for those case notes to even show up. Once you've built the case note, this is like the last step, which case notes then show up as options on your case managers, service coordinators, specialist case note option. And then down at the bottom of this page, another important feature, what do you want your billing restrictions to be for those case notes? Now for early intervention services, I may need to note why I don't have any case note that was billed within 14 days or 7 days or 21 days. Maybe if I went 3 weeks without a service or session, I need to explain why that happened. So by default, I want my billing department not to accidentally bill for case notes that are older than 14 days. You know, if something's been not entered in the system in 14 days, we really can't bill for it. We have an audit issue. So I want to make sure if that gets added to the system, I'm not going to be able to bill for it unless someone goes on the admin end and adjust this date so I can do that billing to do the older billing and then note I might not be able to get paid for that older billing item, but at least I know I'm not going to accidentally submit something that I can't get paid for. So this allows you to apply a billing restriction so that you're not accidentally billing for information that is non-contemporaneous. Okay, so with those provider preferences in place and the questionnaire and case note set up, you can go to your individual tab and you can write a case note for that individual. And I can select a service date. So we did a session note for today, and I don't want to do my default of information and referral, but we turned on those other notes. And I guess I also had a default turned on from my oversight provider. So that's there as well. So I want to go ahead and fill out that early intervention session note that we just made. And then we told the system we wanted all of these top fields to be visible, but not required. So the only thing that's required is the service provider who defaults to myself. Time duration, I didn't want it with a begin time and an end time. I just wanted to note that this is 2 hours, and this tells me it's in minutes, so 2 is not going to be helpful. 120 will be. My service units, if this is linked to that service authorization, that shows up. If not, you'll just have a please select, and you won't be able to select anything. My billing diagnosis code, I think it's using the ICD-9 codes, and then instead of the ICD-10 codes there, that's fine. I think we just have to update what's in our demo account. And then our activity type, your drop down was only for early intervention progress notes, and your location, I think we had about 4 options there. So I can choose one of those options. Was this billable? Was it face-to-face? Who was the person that was contacted? Now, your person contacted will come from, I believe, your IDF contacts. So as you type in someone's name, they will show up. Nothing shows up, so I can type in someone's name and add them as a new person. It's not going to add them to the IDF as a contact, but it allows you to quickly write these billable notes. If you don't have that level of information built into your Therap account yet with the IDF filled out and all of the shared contacts and family contacts, you could do so. I'm going to go ahead and add Rachel as Javier's mother, and I'm going to add his father as well, Victor. And you get that little checkbox once they've been added. Click off to the right and you see the 2 individuals who have been added as the person contacted. You already have the individual there, so as he's going through his assessment or we're doing some training, parent coaching with one of the parents, you can list anyone else who was in contact or in attendance. And then you could fill out your questionnaire. So we have those 4 questions that we built into our questionnaire. Were the parents, caregivers present? Yes. I could have made that a yes, no radio button, but if I wanted more text, like if they weren't present, how did you communicate with them? I could say, no, older sister was present and told information, you can add that information, whatever you need to do. So that successfully saved my answer. If I go back to 1, I've got that information in. I can go back and make changes to it or delete the answer and update it. As I fill these out, so you see 2, describe the progress that the child made. You notice the difference between the single line item and this large paragraph. This is one of those text with multiple lines where you can go and hit enter and have lots and lots of details in this particular answer. So if I want to describe the progress made, I've got 3,000 characters in that multi-line to write multiple paragraphs. And we'll note more progress. And we'll note really good progress. Almost achieved the outcome. So just so you guys see kind of how that looks when we save all of that. Any natural routines that we worked on, we did a checklist so we can select multiple options. And I'll go ahead and save that. And then a place for a parent caregiver signature. I don't want to write anything in this. I left this intentionally blank. So if your session interventionists know to leave this field blank to be able to print this out and have that signature filled by the parent or caregiver, they could do so. So I'm going to go ahead and save that with, I can't save it with no information, but I didn't make it required, so I'm just going to close this. Please remember to save after closing the pop-up. That's fine. So I've got those answered. Do I need to have something for this to show up? That is a good question. Possibly. We'll try and leave this blank to see if it shows up. Okay, so this isn't showing up in my questionnaire. Let's see if it shows up in my print file. If not, you may have to actually have a period or something answered for that signature. A place for attachments, write your notes. You can be very specific in your notes. You also noticed I was entering lines. It does capture the enters between and spacing that you have. It doesn't capture resets many spaces to have this over in the middle, so it's not going to capture those tabs and indentations in your answers note though. FYI, something to be aware of. All right, I'm going to go ahead and submit this note. As I write my progress note here. In full. Functional outcome 1. Objective 1A, objective 1B, and then maybe add functional outcome 2, and all of those stuff that we did. I could put that all in here, and if I don't like something, maybe I want to move this over and move this over so that those indents line up, and do the same thing, copy paste, just like the rest of what you have in Word. You can do a lot of that simple word processing here. I need to add that to make those lines, those bullet points show up. And I want to change this from 1A to 2A and 2B. So you can play around with a little bit of the formatting. Here you have formatting in the lines. Here you don't have formatting. So I'm going to go ahead and submit that. Maybe make this bold and indented and underlined, and maybe make that a little bit bigger. And I'll go ahead and submit that. Now, once this has been submitted, I'm signing off electronically my attestation as the person that's filling out this information. So this is my electronic signature. You're not getting this, you're not getting the falsification of information without that little pop-up message. Now, when I go back to look at that form, see all of that stuff was entered. There's my progress note, and I can print this as a PDF for it to be filled out. So as you see, that number 4 that we had for parent signature, nothing is showing up because we didn't have an answer. So it might be worth your consideration if you want to use that as a go-to to have an answer. You can use that. Maybe at the bottom of your progress note, you have a section for parent caregiver signature if you need this to be signed as part of your PDF. Print your PDF and you get a PDF copy of this to have a parent look at. All right. Any questions? Also, while we're doing that, I'll go ahead and look at this bulk PDF. Once these case notes have been approved, that's not how you spell Javier. Once these have been approved, I can select multiple PDF or multiple case notes. Once they're approved, I can bill for the case note. Or once the template's built and everything and they've been submitted and attested to, I can bill to them. I can also select a bulk of the case notes as a bulk PDF so that you just have a running list. Instead of printing out 500 of these PDFs, you can print out all of them in one bulk PDF file and just print out all of those pages so that you can have a parent sign, the last 2 months worth of case notes that they're supposed to sign off. Now, because the case note doesn't necessarily have the same functionality or flexibility that something like ISP programs have, some agencies in some states will have certain things like session notes actually done as an ISP program, because those can be linked to business intelligence and data-driven outcomes and be able to show things like CARF and CQL measures and show improvement for the individual and over the agency and really dive deep into the data. You get a lot of flexibility with something like the ISP program that you don't necessarily have with the case note. But with the case note, you do have that flexibility to build out those questionnaires and add in the formatting of your case note itself to address those forms and specific things and specific fields that your state licensing person might be looking for in filling out your forms. So it's really something, as you're looking to do this, you might want to consider whether or not the data you're collecting is something that you really want to measure quite often and against data-driven outcomes and how well you're doing as an agency, how well you're doing against global outcomes, or if you're part of managed care and you're trying to show improvements in services across the field. You could do that in case notes, but it's much easier to do it in ISP data with ISP programs. So for certain states, I think Arkansas might be an example to show. In Arkansas, the state is using Therap for early intervention. Their case notes are being used for a different thing rather than just the regular progress notes. Their progress notes are actually done in ISP data. So if you go to look at progress note templates, they have instructions on setting up ISP programs specifically for the collection of a progress note for their early intervention program. So again, this is a state decision. A state decides, they get all the data, they're happy to see it in Therap, and they're happy to look at it in Therap. Your state may not be utilizing Therap for early intervention services across the board, in which case case note might meet those requirements you're looking to do to get all of the guidance the state is looking for, the fields and compliance points within the note. Does it have the duration? Does it have the interventionist certificate ID number? Does it have the functional assessment that was addressed, all of the outcomes that you worked towards, the progress since the last week, all of these things itemized? You can build those in a case note, and you can't necessarily build those and have them look the same in ISP programs. So with that, I think I've held you guys for about an hour. I'm gonna be quiet now, open this up. If you have any additional questions, I'm happy to answer them. This session has been recorded, so we'll have a recording on our case notes webpage, as well as for any blogs or anyone looking for early intervention. In particular, it should link to this webinar if you want to go back and review this at a later date. But we'll leave this open for a few minutes. I want to thank you guys for attending. If you have questions, I'm happy to answer them. If not, thank you very much. Have an incredible rest of your day, and we'll talk to you again soon. Thank you.